All right. So, good afternoon once again, and you are welcome to today's session.
Good afternoon.
Mm, Yes, sir. So, we'll take our prayer. We'll call on our district secretary, Honorable Leo, to pray for us to start the session. Thank you.
Thank you very much, Honorable Chair. Please, let's say a word of prayer. Father, in the name of Jesus, we thank you this afternoon for your grace and your mercies. Father, we pray committing this, our educative session, into your hands. We pray committing it into your hands that by the time we are done, we would have learned a lot and it will translate in our chances of moving further in our profession. We thank you, we glorify you, we thank you for successful session. In Jesus' name, amen.
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 So, once again, thank you all for availing yourself. I know it isn't easy looking at the network issues in some of the facilities. Just from some of the facilities and the network issue, it's something that is worrisome. So, all those who are on the call so far, we are so grateful for availing yourself. So, this session is about steady leave. We all know how important it is for us to advance ourselves as far as our career is concerned. And this also comes along with our money. You know, more often we have nurses who have been working for decades, but there is no any major impact when it comes to their salaries. And so there are courses that if you pursue, it will end up affecting your salary. You get good salary at the end of the month, which will also affect your retirement benefit. And so after going through every facility within the district, interacting with all membership, we agreed to have this session today. And so we spoke with our regional executives to get us a very resourceful person, someone who understands the ins and outs of study leave, someone that in case we have any issue, he will be able to help us as far as the leave is concerned. And we were lucky to be given a very important and a very senior most person, who is in the person of Mr. Mensah. He's an HR with a lot of experience. And I must say that since the regional executive has recommended him to us, it means that we don't have any problem as far as the leave is concerned. And so, Mr. Mensah will invite you to take over and take us through the session. So, the podium is yours, sir. Thank you.
All right. Thank you, Honorable Chair, and good afternoon to everybody on the call.
Good afternoon, sir.
Good afternoon, sir. So, I'm making you the host right away.
Yes, I would love that. Besides Honorable Secretary and Chair, I'm not hearing any other voice, but I can see 16 participants on call. Can I get a hello or a hi from somebody else who is on the call?
Hello, we are here.
I see. Calling from Edumfa Chips, eh?
Edumafa Chips, yes.
Elizabeth, what do you have to tell us? All right, so I believe we don't need to waste much time. I know our nurses and how we have a lot to be doing at all times, and we have to juggle between work and family and all other manner of things that are happening in our life. So I won't waste much of our time, but I will plead that we try and stay glued to our screen so that whatever I share and speak about, we will get it. After I am done with my presentation, Chairman has informed me that a few of us have some questions. So there'll also be time for Q&A. And then whatever that is bothering your mind, we will try our possible best to bring meaning to it and clarity. So I hope with that said, I am discharged to move. And if you are with me, you can say a go so that I proceed.
Yes, please.
So this very afternoon, I'm invited by your executives, and I must say that this is a very nice initiative. It is a great one. So if you happen to be a beneficiary of the Grnma in Ekumfi, you should count yourself blessed and fortunate. Many a times, because we don't know the rules of the game or we don't really understand a few things that we ought to know, what happens is we go into the system blind And then the unfortunate sometimes happen. But as we all know, ignorance has never and will ever be an excuse when it comes to legalities. So without wasting much of our time, my humble self, I'll be taking all of us through the Ghana Health Service study leave and a few things we ought to know. So before we now even tackle the issue about study leave, a couple of times being a practitioner myself, a few staff or officers will approach you and then they will go like, HR, me pese me go school. For those of us who don't understand, the person is just saying, HR, I also want to gain the opportunity to further my studies this year or next year. And typical of me, the question I'm going to ask you back is, who do you see yourself retiring at age 60? Because you know, the career is like a ladder. It has a starting point when you gain your appointment letter into the service. And hopefully someday, according to our Pensions Act, you would have to end your service compulsorily at the age of 60. So when I ask these questions, what I am trying to ascertain is that, do you really have a career plan? Or is it because your friends are saying it is time to apply, I'm applying? You ought to have a career plan, because just like your career has begun in the service, someday you would have to bring it to an end. But then when you know the end from the beginning, it is very easy for you to reach your destination. I don't know if I am making some sense with this analogy. Am I?
Yes,
So
please,
if you know that I am going to leave the service as a DCNO, if I'm going to leave the service as a CNMO, if I'm going to... Hello? Please, I will urge all of us to try our possible best and mute our microphones so that the rest of us can hear me loud and audibly. You ought to have a career plan, because it is a plan that will guide you throughout your journey or your career journey within and outside the Ghana Health Service. So a career plan refers to a process which an individual becomes more aware of his or her, one, your interests, two, your motivations, and then three, your needs. Now, when we say interest, what are your interests? Is it that you want to become a CEO? Is it that you want to be a founder? You want to be an owner? You want to be a journalist? You want to be a nurse specialist? On and on and on and on. You can add on to the list. But then what is motivating you to choose to become the nurse specialist? What is motivating you to become the public health officer? What is motivating you to become the ophthalmic nurse, the oncology? What is really behind your motive? That is answered with a why. Is it because you believe it is your destiny or purpose? Is it the joy of the job? Is it the financial freedom that this desired journey or occupational choice will bring to you? Or it is the prestige that today, by God's grace, I'm also a DCNO, or formerly the DDNS, because even now that is DCNO, we still like the DDNS because it used to carry a lot of power. DD. Now that you've identified your why, your next thing will become the needs. And the needs answers the question of the how. How am I going to get there? Is it going to take some more education? Is it going to take some trainings? Do I need a mentor? Would I have to travel outside my domain? Because some educational qualifications or academic studies would have to take you outside your domain. So some courses may not be offered in the central region. Some may not be offered in Accra or from wherever you are listening. Some may not even be offered in Ghana, and it has to be outside. So when you know the how much money will this cost me? Because education doesn't come cheap. So these are some of the things you would have to plan and consider before you do what? You move in to say, I want to do program A, program B, or program C. Because if we are all coming from Ekumfi going to Accra, what we are going to do is we will not pick any car heading towards Cape Coast. True or false?
True.
Hello, is somebody? Exactly. Because the moment you pick a car that is going to Cape Coast, it means that your destination, which is Accra or Kaneshi, is not going to be what? Fruitful. True of us.
True.
So my aim this afternoon is to help us and guide us so that we know that our ladder has been leaned across where we want to be, so that we don't choose A or B program and it is contrary or very opposite to where we want to find ourselves someday. So I'm saying that a career plan must be deliberate. It must also be strategic and then continuous, because life changes and life happens. So what are the few factors you would have to consider when you are planning your career? You have to look at, what is my purpose as a person? And this may not come in handy, but when you say, oh, I'm going to pursue BSc nursing, general nursing to be specific, as a senior enrolled nurse, and then you pay your fees, you start the program, a week or your purpose, it is likely for you to quit. Second thing we can look at is a career goal. So do you have a career goal that says that once I've been in the service on my 4th year, I would have to apply for this program, and after I'm done, this is what I'm going to do, and this is what I'm going to do? If you have a goal, it guides you. You don't just join the bandwagon, and when they say they are going for midwifery, you also jump in. So it is very important that you have a career goal. Then you also have to take cognizance of your age. We are going to find out that at a particular age in the service, it is very hard for you to secure a steady leave provisional approval. Now you have to look at your health. With every occupation comes with its own occupational hazards. So am I physically fit? Am I mentally fit to really pursue this occupation or this particular grade that I am eyeing for? Because perioperative nurses, I'm told, and I've seen, I've observed, that they have to stand on their feet for very long hours. So maybe perhaps you are not so able in that sense. You have a spinal issues, you have what's not issues that may affect that choice. You don't go ahead and choose it, because at the end of the day, when you are done with the school, the service expects you to do what? Practice with that qualification. And you can't say that because of X and Y now, although they have spent money sponsoring your tuition by paying your salary throughout a year, 2 and 3, you come back and say, I am not what going to upgrade or convert myself in the qualification I've obtained and do my duties as such. The next thing you have to look at is, what qualification must I obtain? Some of us will be applying for all sorts of programs, but then we haven't found out from the schools that I am an enrolled nurse and I have a hack or a knack and I want to do physician assistantship. Would you admit me with my hack or knack, or must I use my WASI or the SSC? These are inquiries you need to make from your desired school of choice. Because if you don't do that and you just buy your forms blindly, or you just select the program now, you may obtain the provisional approval, but when it is time for you to gain admission, the school will now deny you of the admission. And every provisional study leave obtained, you cannot defer. So make sure you know you have the requisite qualification in order to earn you an admission into your desired school for the program of choice, even before you hop onto the system to choose what? A program. Now, finances. Do you have the financial muscle? Yes, salaries are going to be paid, but then do you really have the money that it takes to pay your fees, to pay the what's not, the practicals and all that financial obligations you ought to meet? Knowledge, skills, and abilities. I would even add attitude in this regard. You know, every job, say if I'm a community health nurse, there is a particular kind of knowledge, skills, and abilities and attitude I might exhibit. But that is different from somebody who is a health promotion officer. It is different from somebody who is a nutritionist, different from somebody who is an accountant, different from somebody who is a perioperative nurse. So do you have some knowledge? Do you have some skills? Do you have the ability? Do you have the attitude? So if you really don't like to talk much, then it means that health promotion, health educator, these are not programs that is what will be best suitable for your personality or your being as a person. Now let's look at network. Do you know enough people already in the industry who can give you insight and say, my friend, this physician assistantship you want to choose, it is not as juicy or green on the other side as you see it. I would rather advise you to do what? To choose X or to choose Y. Because sometimes when we are on the outside, we feel like the pastures are more greener on the other side. But then if you don't have anybody who is already in that role to tell you some of their challenges and issues, you will end up throwing away your diamonds and then picking what? Stones. The next one is industry knowledge. So with the Ghana Health Service, how are they treating category these people? How are they treating these people? What are the disadvantages? What are the advantages? And this time I'll ask you not to think just with the Ghana Health Service, but then to think as a health sector as a whole. What qualifications must I have? And if I have this qualification, how much will it earn me? What can it do for me? Laying much emphasis on our career plan, let's move into what we are set to do today. We are to know much about study leave. And this is the definition of study leave per the Ghana Health to an employee for the reason of undertaking an approved training program. So the emphasis is on leave of absence granted with. We have the study leave with pay, which means that while you pursue your program, the government or the service is going to keep on giving you salaries. You are going to be paid salaries while you pursue your further studies. And then we have the study leave without pay, where you'll be pursuing your program, but then you are not going to receive any salaries from your employer, which is the Ghana Health Service. However, upon completion of your program, you tender in your certificate and you are being upgraded or converted per the program you pursued, and then your salaries can begin to be paid back to you. Now let's look at a few study leave guidelines per the policy. It says that an employee who is not eligible for study leave with or without pay may have to resign from the service if he or she wants to pursue any further studies, provided he or she is not under bond. So this speaks to maybe you just joined the service, you've served 4 years, 5 years, 6 years. It is your first time to enjoy a study leave. And then you are also not under any bond. Now, what the policy is saying that some of you may want to. Hello, Gloria. Can you please mute your microphone for us? Thank you. So if you are not eligible, so some of us maybe just, this is our 3rd year and we may want to apply for certain programs. We go on the portal and we are told that you are not eligible. You've not served the minimum years required. It means that you can opt for what? A study leave without pay. And then some of us, the courses we want to do today, there are not even any established grades in the system. Somebody may want to do strategic communications or marketing. In the Ghana Health Service, as we are today, we don't have job roles for such people. So it means that if you want to pursue those kind of programs that we don't have any vacancy or job establishments for, you would have to do it. The next point is an employee shall not be entitled to study leave with pay for more than 2 occasions, except with the explicit approval of the Director General. This is saying that once you join the service, from day 1 until a particular age, you are only entitled to pursue further studies or gain approval to studies twice. So when you exhaust one, you have another chance to go for another study. And then when that is done, if you want to enjoy study leave for the third time, you take over from what? The director general. Madam Joyce, can you mute your microphone for us? Study leave requirements. What are the requirements for the policy? An employee may be eligible. All right, can I proceed? Are we all clear now?
Sure.
All right, so you would have to serve a minimum of 3 years to be eligible. And I always say that application is not approval. So in Ghana, we are told that once we are 18, we have the right to vote. But it is not by force or compulsory that you exercise your franchise. So 3 years in the service, you can go online and then try to apply. And then even with even with the application, it doesn't mean that you are going to be granted the approval. So when you hop onto your portal now, you will realize that the kind of programs that you can pursue based on your current grade it has already been tailored. So maybe you have not served a number of years, and then you may want to pursue BSc nursing. When you click on it, you will now get a pop-up saying that you have not served what the minimum years required for that program. Okay. Second is an employee may be eligible for a second study leave after serving the required bond duration after the first study leave. So if you had the chance to pursue a diploma, a degree program, and then you are done, remember you have a bond to serve, and then we will go through to know the duration that you have to serve for a particular course of study and how long for the program. Employees working at stations regarded as deprived or hardship location shall serve 1 year less than normally required for study leave with pay from the date of first appointment, reappointment, or return from study leave with pay. Now, in Central Region, the deprived districts are Upper Dentra East, Upper Dentra West, Asen North, Asen South, and Trifuhiman Lower Dentra. So out of the 22 districts in Central Region, we only have 5 districts that are deemed to be deprived. And unfortunate for us in Ekumfi, it means that we are deprived per the standards. Employees above 50 years shall not qualify for study leave with pay for a long course, which is any program that spans beyond 2 months or 1 academic year. However, consideration may be given to employees who have served for at least 4 continuous years in deprived or who have documentary evidence that they have distinguished themselves on the job. So it means that if we are in Ekumfi now, and then we have age 50 and beyond, we can't select or pursue a program, try, apply. Got so many criteria or 1 or 2 for the program, but this is the position of our policy pending against an employee applying for the study leave. You see, when you are done filling your online, you would have to print out a form, sign, submit to your HR. Your director will also has a place to endorse and recommend you. There is a portion that will ask if there is any disciplinary action or proceedings pending against you. And if they tick no, it means that although you were able to get, if they tick yes, sorry, that there are disciplinary actions pending against you, although you were able to apply online, there is no way the committee that is recommending people or applicants is going to recommend you. Are we clear on that? Now let's look at some study leave conditions. Study leave with pay awardees shall be obliged to serve the Ghana Health Service in a facility to be determined by the Regional Director of Health Services for a stipulated period as stated in the table below, upon completion of what? Their training program. So if I'm to pursue a program that is going to last for a year, maybe it's an MSc program or an MA program or an executive MBA that lasts for just 1 year, it means that I will be serving Ghana Health Service upon completion of my program for 2.5 years. 2 years, we serve 3.5 years. 3 years, we serve 4.5 years. 4 years, we serve 5.5 years. So it is the duration of your program plus 1.5 year. So let us take note of that. There will be no study leave with pay for courses for which Ghana Health Service has no establishment. As I mentioned earlier, if you want to study marketing, horticulture, strategic communications, and some other programs of study that we don't have any grade for in the Ghana Health Service, it means that you can't do what? You will not be granted with pay. However, you now have to opt for what? The option of study leave without pay to pursue those programs. A course may be relevant for the career progression of the staff, but the absence of a vacancy within the establishment takes precedence in considering what? The grant of the study leave with pay. Very soon, like I spoke to your chairperson behind the scenes, that the quota is not yet in. We are told that it would be in, and very soon we will be asked to disseminate it. But then until then, let us be guided, because your choice must come from the quota that Central Regional Health Directorate has done what? Has captured or has been able to put up. So please, I will caution all of us on this call not to go ahead and submit applications until we see the quota. Because whatever program you pick, if it's not in the quota, it means that you cannot be granted provisional study leave to pursue the program. An officer on study leave with pay shall not change his or her program of study unless there is a clearance from the approving authority. And in this case, the approving authority is way in headquarters, not at your facility, not your district director, not your HR, not your nurse manager. The approving authority is where? In headquarters. So if you ever want to change the course of your program, you chose BSc nursing. Now, for some reason, when you were granted provisional approval for BSc general nursing, you say, no, I rather want to do public health nursing. Don't go ahead, buy your forms and start your tuition. Because when you attach your admission letter to your bond form and submit for your final approval, it will not be granted. So please, if you ever want to change your program after you have gained provisional approval, contact your HR. He or she will guide you, and then you will know what to do. Applicants who commence the study leave without receiving feedback or response to the application shall be deemed to have vacated post after 10 working days. Then an embargo will be placed on your salary at the bank, and your names will subsequently be deleted from the payroll. So usually when we just secure provisional approval and we gain admission, we just leave without informing the HR, district director, medical superintendent, and our supervisors, because we feel our name has been captured in a document called a provisional approval. We just go ahead and then we leave for school. When the provisional list comes, God willing, when you read, you would now realize that you will need to secure admission from a school and then go also onto the portal, fill out some documents before you can go to school. So please, if you don't do this, don't go to school. Speak to your HR, get it done before you leave, so that you don't end up in trouble. An employee shall be regarded as having vacated posts and his or her name deleted from the payroll if he or she fails to report to his or her head of BMC. And here, your BMC in Ekumfi is the District Director of Health Services. So you need to report to him or her when your study leave expires. If you don't do that and 10 working day elapses, that is vacation of post. Sometimes because the approval will come and it is stated in there that you will end your study leave on, say, October 2025. And then you were done with your school August 2025. Typical of us, we will say that 2 months, you made a better fee. You see, when you are done with your school, you are not done. You will be asked to provide certain documents for upgrading or conversion. And it is there and then that, you see, whatever act you committed, thinking it won't be of any consequences will catch up with you. Because when you are done with your school and then you graduate, if for nothing at all, you also have other colleagues who after your program will report for work. They may not be in Ekumfi, they may be elsewhere. And just like we as nurses as a profession have friends and colleagues elsewhere that we rely on for information, HRs, medical superintendents, medical directors, they also do same. So sometimes they will know that you are home, but they may not bother calling you to come to work until something like this happens, and then it becomes unfortunate. So please, as soon as you are done with your program, even if the duration is not, you come, because it helps your documentations, and then your upgrading or conversion comes on time or within time, and then you can enjoy the increment in your salary. Employee on study leave shall be required to produce certified academic reports every academic year to the approving authority to guarantee continuous enjoyment of study leave, including any sponsorship and payment of salary. Today, we don't practice this so much, but because a lot of us are japaring and we are seeing that people will take study leave, yet they won't go to the school or pursue further studies. We are being advised to start enforcing this condition that pertains to the study leave. So very soon, you'll be there, we will write to your school and tell them to give us your transcript, which is your academic report, and then we will be forwarding it to headquarters. And if they realize that you are not pursuing the program or you are not doing well with your program, it means that we would have to stop your salary, ask you to come back to post. And the unfortunate thing is you will still have to serve a bond depending on the number of years you've spent in school. So if your program was 2 years and 1 year, we ask for your transcript and it's so bad, it's so poor, you don't even meet the grade points that you need to have to pursue the further studies, we would tell you to come back to post. And because you spent 1 year in school enjoying salary, you will now be bonded to serve 2.5 years. Because remember, whatever years or duration you spend for the program, you now have to spend 1.5 years in addition for what? To serve the Ghana Health Service. Continuous payment of salary of an officer on study leave shall depend on good conduct and satisfactory academic performance. I think I've said it, so we don't need to waste much time on it. Now let us look at the schedule for processing the applications this year. 1, declaration of intention for further studies using the online study leave portal. So we are saying that all interested persons can hop onto the portal, which was opened today, and will be closing on the 16th of October, 2024. I already spoke with your chairman, emphasizing that the study leave doesn't run on a first come, first serve approach. This morning, somebody woke me up as early as, I think, 7 something with a message that she has visited the portal and it's not open. I understand the anxiety, but let me say this in our local dialect. So, it will be to your own detriment. So let us take our time. You can even apply on the 15th of October, and then you will still do what? Be able to get your application through successfully. Point 2, endorsed declarations of intention forms will be forwarded to the regional director from the 17th to the 21st of October. Now, although it is stated here that 16th October is the last day for you, depending on the administrative plans of your HR or your district director, they may decide to tell you that make sure you are done with your applications on the 10th of October so that you bring it to them. Then they will now do due diligence, go through the pain and the rigor, and know, sometimes they will have to correct some of you, the programs you selected, and inform you. I've once had an enrolled nurse who selected associate membership pediatric, and the system allowed the person to select. But in practicality or in reality, an enrolled nurse with a hack or a knack will never gain what? Admission into the Ghana College of Nurses and Midwives to pursue such a program, because you don't have the requisite qualification, which is what? A diploma. So you can go online and select certain programs, but it doesn't mean that your application will be screened and then it will sail through the screening process because you selected wrong. That is why earlier with the career plan, I said that have knowledge of the requisite qualifications you need to gain admissions for the program. Ghana Health Service only grants you what? The study leave provisional approval, but we don't grant the admission. And the schools that grant the admission have their own cutoff points, have their own screening tools, procedures, and whatnot to select applicants for the programs that they want to pursue. So please, let's take note of that. Now, when it gets to the region, there is also a team or a committee that has been set up. So from the 21st to the 30th of October, they will be shortlisting study leave beneficiaries according to what? The quota. That is why I say for you to be proactive and be ahead of the game, wait for the quota, because even those who are going to select you are going to do that by the quota. So you who don't have the quota, why should you go ahead and select the program? So please, I will entreat all of us again, until you see the quota that will guide you, do not select a course of study and submit your application. Because the same people who will now be shortlisting you will use the same quota. So it is in your best interest and an advantage when you do what? You have the quota before selecting. 4, submission of recommended staff list on the online portal, and then hard copies will be forwarded to the Director of Human Resources for validation. And this will take place from the 1st to the 8th of November, 2024. Some of us will go online and then we will do it. Once we've submitted, we think that is all. We don't print, we don't endorse the form, we don't submit to our HR. Now, what you have done is, yes, you have submitted the online, but regional needs your hard copy for screening and onward submission to what? To headquarters. So you realize that although you've done your application or successfully completed your application online, because you didn't submit your hard copy, there is no document for you to go through the screening process and when you qualify, onward submission to headquarters. So please make sure whichever date or whatever deadline your HR gives to you, you follow suit and get your document to their office. After it has gotten through the screening process at the regional level, and it is forwarded to Director Human Resource in Accra headquarters, they are going to review and validate the staff that has been recommended at the regional level. So we see the kind of scrutiny or screening processes and criteria our applications go through. So Director Human Resource will now be validating every application that comes to his office that were recommended at the regional level to check if they really followed the guidelines or through due processes. That will be done from the 11th to the 22nd of November 2024. So when they are satisfied with this screening at the headquarters level by Director Human Resource, then he will now be in the Director Esquire Obriyeboa, Director for Human Resources, Ghana Health Service. He is going to forward that recommended list to Director General for final approval. And when approval is granted, then we see the letter that usually comes out to say that X and Y have been granted was provisional study leave, pending that they gain admission to pursue further studies. So this is the schedule for the processes that our applications will be going through. And I must say that most of these days are tentative. They are not fixed. So they are just to guide administrative proceedings. So it may be that although we are seeing that from 25th of November to 6th December, we are supposed to get back and say that I have gained approval, I didn't gain approval. However, it may take us into next year before we get a letter from headquarters. So the days we see here, besides the 16th to the 16th September to 16th October, that the portal will be opened for applications. All the other dates are tentative dates, so let's take note. Now, what is the criteria to be used to determine study leave quotas? I have been making mention of quota. And very soon the quota will come, we will see it. A lot of us have seen it. It comes out and you see that this particular program, they say they are looking for only 11 people in Central Region. This particular program, we are only looking for 15 people in Central Region. So there are numbers attached or matched to every and any kind of course of study or the program you want to pursue. So one, for those of us who would want to pursue the associate membership, the membership and the fellowship at the Ghana College of Nurses and Midwives, this is what happens. It is not the service that determines the number of people who will pursue the program. Rather, it is the college that says that for us to run peri-operative nursing membership, we are going to have a class of 30. And because we are going to have a class of 30 and it's limited in number, we will grant Northern Region 6, Central Region 9, Bronx Ahafo 1. Sorry, now it's even Ahafo 1, Bono 2, Bono East 3. That is how it goes. So it has nothing to do with Director General or Regional Director. So if you see that they say peri-operative nursing membership is 3, don't think your HR or Director General is wicked. Your doors will be Ghana Health Service staff, yes, Ekumfi, yes, and I'm quota 3 per aba. No, it is the school that is running the program that has given the number that they want to take from the region. Now, with the quota for the other programs like BSc Nursing, Diploma Nursing, BSc Health Promotion, and the whatnot, those ones are determined by a study leave allocation model. And they use the staffing norms, the staffing gap, the population of your district, and the workload of your district. If you ask your health information officer, they'll be able to tell you what the workload of your district or where you serve. So this is how it works. The staffing norms is an establishment of the particular number of staff and the categories you need in a health center, in a CHIPS compound, in a district hospital, regional hospital, and the whatnot. So we know that in any health center, maybe we need 15 enrolled nurses. We need 30 professionals, which would be the registered general nurses. We need 15 of public health nurses. It has already been established. So if we already have 14, it means that we only need what? 1. Therefore, the quota that will come will say that we only need one person to pursue this program. And it means that every person who is eligible will now have to fight for what? That one particular slot. If we have 15 midwives, but our district needs only 20 midwives, or Central Region needs only 20 midwives, but we have 50 midwives, it means that our quota will come for what? 5 midwives. Because if we exceed and now have 23 midwives, the 3 additional midwives will not be doing any job. And in labor economics, it is not what efficient way of managing resources. So please bear with the service. It may not be a language you understand. But then if your bed capacity is 15, do you admit 30 people? Can I please get a feedback to that question? If your bed capacity is 15, can you admit 30 people?
No, please.
Hello?
No,
Exactly.
please.
So if the service, exactly, thank you very much. So if the service needs 50 general nurses, and as we are speaking, we have 40, it means that we only have room for 10. And that is why they will bring and say the quota is only accepting 10 people, and everybody has to fight for that 10. So the number keeps changing per the staffing needs that the region requires. Thank you very much. Now, a guideline again, we are saying that regions are required to constitute committees. This one I've already spoken about, for the selection of steadily beneficiaries based on what? The quota. So if they have been able to establish that we only need 10 additional midwives in Central Region and the quota is 10, it means that even the committee should be guided by what? The same quota. They can't select 15 people. They have to select what? The 10. And I say we should take the pain and then wait for the quota, because the quota sometimes tell you how many people they are willing to let go for regular or for sandwich programs. So sometimes you see that BSc regular is 15. BSc sandwich part is maybe 60. Then it will be wise and prudent of you that because the numbers for the sandwich is larger, go for that one. Because when you go for the smaller one, which is 15 and regular, if 200 people apply, all the 200 of you will now be fighting for what? The 15 slot. And that one will be to your own disadvantage, because maybe you just served 5 years, you just served 6 years, but somebody has served 14 years, 12 years, 9 years. Please, am I making some sense with that? So let us wait and be guided what? By the quota. So while quota now should be their numbers, not those then do what? Join them there. Because if the number is plenty, then it means that even if you also cry, the ratio or my chances of getting it, the probability now becomes higher compared to me chasing a quota that has what? The least number. The guideline below should be used together with the criteria regions may devise based on their peculiar regional needs for the selection of what? The beneficiaries. So despite the fact that all of you have copies, and I know it was disseminated somewhere last week on the guidelines, they have given some room for the regional director and the committee to also come up with their sub criteria. So you see, it's just like those of you at OPD, when you do your triaging, there are certain signs you look out for before you say somebody is red, somebody is green. So they also have what? A selection tool that they're also going to look at. And they have the onus, or they've been given the privilege and mandate area they would want to use for a particular program. So please, let's be guided. Now, deprived district incentives. As part of the Ghana Health Service non-financial incentive for staff working in Ghana Health Service designated deprived districts. And for those of us who have been on the call for a while, we all know that in our region, Ekumfi is not a deprived district. We have Upper Dentra, East and West. We have Asen North and South, and Chifuhiman Lower Dentra. Those are the 5 districts that are deemed to be deprived in Central Region. We are saying that those people in deprived districts, Staff in these areas are required to work a year less than the minimum years required to be eligible for further studies. And this time, they are going to use the HRIMS. The HRIMS is an online web-based information system that the HRs use. And it is the same portal that we are being given a portion of it, or should I say, a phase of it for us to apply or tender in our applications for study leave. So you will realize that when you go on there and then you register, the first thing they are going to demand is your staff ID. When you key in your staff ID and submit, some details of your profile will pop up: your date of birth, your name, your current grade, your current district, facility you work. Please, if you go through that and realize any of the information is not accurate, kindly just get off the portal or screenshot it as for evidence, and then call or visit your HR and tell them, so that they correct those informations for you, because it can go against you. You may have been an SSN, senior staff nurse, senior midwife, senior staff midwife, or whatever grade today, but because you went for the first half promotion and your documents just came, your HR might not have updated your records. So on the system, you will still submit your application as a staff midwife, as a staff nurse, and that one will go against you, because those people who are showing senior and you are showing staff, they will just deem it as Oba and Chair. So please, maybe your age on there is showing 55, by yourself you are just 45. It means that if you select a program that is going to go beyond 1 year, automatically you'll be what? You'll be taken out. Unless that program, nobody else selects it, and then they now recommend you for Director General, adding a note that although they want somebody to pursue that program, nobody selected it, and you being the only applicant, you are about 50 years, and then Director General may consider you and then do what? So your age, your current grade, where you serve, and all those things, they matter. Please, they matter. I'm laying emphasis on that because that can be the reason why somebody is denied what? Approval. Now, your choice of study of the program. Any staff who wishes to pursue further studies with pay shall have no opportunity to select programs outside those approved for the various professions. So once you want to enjoy study leave with pay, as I mentioned earlier, the system now, the moment you hop on it and decide to choose your program, they have already tailored the kind of programs that the service would want you to pursue. In HR, we call that career management. They're already managing your career path. So what they've done is to say that if somebody is a male, you would now have to admit the person in a male ward. You don't admit the person in a female ward. If somebody is a child, you don't admit the person in male ward. You admit the person what? In the pediatric. So it is same. They look at your current program, they look at what you can do, and they've tailored it. So if you see that your desired program is not in the list, quickly contact your HR. Maybe it's an issue. If it is not an issue, he or she will give you feedback and say that you cannot pursue the program, or you can't find it in your list because of X and Y and Z. Because he or she will be contacting region, and there's a person who has been, his office has been designated to do what? To cater for these issues. So you, the staff, may not be able to contact them, but your HR can do that on your behalf. Or there is also an interface on the system, complaint hub. You can click on the complaint hub and then you put in your complaints to say that I have the desire to pursue this program. However, I can't find it in my list. And then they will give you feedback in due time. Where a staff interest lies in a program other than those approved, other funding opportunities outside the service may be explored. So maybe you attend the Church of Pentecost, or you belong to Association X or Y, and then you would want to pursue a particular program, but then you can't find it. And the service also says that they are not willing to help you pursue that program with pay. This one leaves you only with the option of what? Study leave without pay. So you have to find other additional funding opportunities. When you secure it, when your admission is in, you attach that note or letter that speaks to your funding opportunity. You add it to your admission letter, write a letter to the regional health director stating that you have gained admission for this program and this is a sponsorship, so you would want to pursue it. And when they consider and you are eligible, they would now approve you for study leave without pay. Now, study leave quotas. We are saying that all programs have their corresponding quotas, and regions are strongly advised. You realize that just in one document, they keep on laying emphasis on it, that all programs have their corresponding quotas, and then the regions are strongly advised to be guided by these quotas in selecting the process. The service considered various factors in arriving at these quotas, and I've explained some to you. If you have a bed capacity of 15, you don't go admitting 30 people. So if they know that central region, per our workload and our population, we have the nurse patient ratio and all those things. So they put that into consideration and realize that it means that we need X number of people. So if you have Y, what is the difference between X and Y? If it is 30, they bring it up as the quota. Now, the quota for diploma midwifery, diploma community health nursing, and diploma general nursing cover staff who are pursuing them as either post-basic or direct. So when you see that there is diploma midwifery, diploma community health nursing, diploma general, it means that whether you want to consider it as a post-basic or pursue it as a direct person. When we say direct, I don't think because this program is organized by Grnma, I may have health assistants on the program or on the call. So it means all of us are either enrolled community health nurses and then registered nurses upwards. So it means that we would all now be pursuing this program if you are a certificate holder as a post-basic and not direct. Special allocations have been made for staff working in deprived districts again. So you will find out that, or when you now see the quota, you realize that there is a portion that will say BSc nursing midwifery, into brackets, deprived. When you see that number, don't target it because you and I who are in the Ekumfi, we are not what? Deprived. It means that it belongs to the 5 districts who are in Central Region, not you. These quotas are exclusively for staff working in the locations that are officially designated as that. And then they can pursue this program on a regular, full-time, or any other mode that they want to. BSc nursing, midwifery, part-time, sandwich, and weekend. They say that as much as possible, staff in non-deprived districts shall be considered for flexible modes of pursuing the above program. So you and I that we are in Ekumfi, if we are eyeing for BSc nursing, BSc public health nurse, BSc midwifery, stick to the quota of what? Part-time, sandwich, and weekend. Don't go and join the deprived queue. It won't help you. It means that when you still go ahead and join the deprived queue, your chances of what? Securing approval is what? Very, 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 very small. If you want your chances to increase, then they are advising you that join the queue for what? So it is therefore advised that in selecting beneficiaries for this quotas, due consideration should be given to those who are by virtue of their location who easily access these programs on part-time, weekend, and in some cases, sandwich basis. BSc, full-time or regular. This quota is for what? Registered nurses and midwives working in deprived districts. There is a know that it is not for you. It's for what? The deprived districts. It is only when they realize that a lot of people in the deprived districts is more room, then perhaps they may now consider the people in non-deprived districts for the allocation or quota that was made for what? Our sisters and brothers in the deprived districts. So in selecting staff for this quotas, it is strongly advised again that staff in remote looks, the people in those 5 districts are ahead of those. Difficult for them to go for the modes of what quota for certificate nurses for the degree nurses, what our certificate nurses, which is our enrolled degree programs, and it is part of the efforts that the service wants to bridge the existing professional or auxiliary nursing staffing situation. The service has realized over a time that there are a lot of certificate, as the layperson will call it, certificate nurses, which is the nurse assistant preventive and the nurse assistant clinicals. So in order to bridge the gap between the number of enrolled nurses and community health nurses we have in the system and the professional ones, let us give them a separate quota. So if you are listening to me on this call and you are an enrolled nurse, whether from senior enrolled nurse to superintendent or senior community health nurse to superintendent, it means that there will be a special quota for you. So you realize that there are quota for all of us may be nurses and midwives, but then they've grouped the quotas into different classifications. So they are for those that are for enrolled nurses and community health nurses. There are those that are for registered nurses, which is the diploma people. And there are those that are for those who are also in the deprived areas. When you know this, it guides you in selecting your program. Now, this is according to last year. These are some recommended courses for community health nurses and enrolled nurses. So you can already see it on your screen if it is visible. Our community health nurses can apply for a BSc community health nursing, BSc public health nursing, midwifery, physician assistantship, diploma midwifery, diploma CHN, diploma community mental health, diploma health promotion, diploma nutrition. The list is not exhaustive. As I mentioned earlier, now because we are online, when you hop onto the portal to select your program, any program that you can select or is recommended for you is tailored already on the system. So the moment you click your program, you can take the pen and read through all the programs that are available for you to choose. And I know you will find these programs there. Enrolled nurses, we have BSc General Nursing, BSc Midwifery, BSc Physician Assistantship, Diploma Midwifery, Diploma General Nursing, Diploma Community Mental Health, Diploma Health Promotion. You realize something like nutrition is not there. But like I'm saying, this was for last year. We've not had a document on this for this year because it is already in the system. So there is no need to come up with another separate document. The moment you hop onto the portal, every kind of course that has been recommended for you will be shown on your screen. Courses that require conversion after further studies. Now we've all been hearing upgrading and conversion. Per definition of our policies, upgrading will mean that if an officer pursues further studies, that is in line with their current job class. So if I'm an enrolled nurse and I go to pursue general nurse, because it is within my job, health nurse, and I go to pursue midwifery, I am moving from the nursing class to the midwifery class. So that one becomes what? A conversion. Let's have that at the back of our mind while we discuss this particular slide. So when it becomes necessary for any staff to pursue a course that necessitates what? Conversion to another occupational class, they are going to consider your present grade and the salary of the staff against the grade and the salary of the new grade of which the person will be placed upon. This will ensure that staff are not disadvantaged after a period of further studies on account of conversion. Let's see what that means to our salaries. Let's look at a superintendent community health nurse. This person currently is on a salary grade of 16H. But assume a principal community health nurse, which is the same grade level for a principal enrolled nurse, is a 14H. So let's say now I'm tired of nursing. I want to go and pursue catering. I have a certificate in nursing, right? And in going to pursue catering, catering officer, it will mean that I'll have to have an HND, probably in hospitality management or any other equivalent qualification. While you've gone to school for 2 years, 3 years to study hospitality management, you come back and then now your new grade will be 14L. Meanwhile, you've gone to school for 3 years. You've gone to pay school fees. You've gone through the rigor of studying, assignment, and all those things. Meanwhile, your new grade salary is what? 14L. Maybe you say, I want to move into dental technology. That is what? A diploma grade in what? Dental technology. So you become a dental technician, hopefully, upon completion of your program. 15H is what you'll be starting from. So it means that you are at what? At a disadvantage. Meanwhile, you pursued further study, and that qualification is higher than what you have. So you are going to study an HND program. That is true. You are going to spend 3 years in school. That is true. But then you come back taking what? A lesser salary, because you are now going to climb the ladder of your new grade again before you get to the top. Just like an enrolled nurse will start from 12L, I believe, and then go up. A staff nurse or midwife will start at 15H and climb. It is the same. So you realize that although now you have additional qualification, your salary is lesser than before. So don't go ahead and select such programs because they will be considering it. And due to the fact that you'll be at a disadvantage, they may not approve it because it will be to your own harm or detriment. Courses like technical officer, lab pretendant, and you say, I'm tired of nursing. I want to move into lab. No problem. But then it means that you will be starting at 15H. Same for our people who have crossed from the diploma level to a nursing officer level. So I've climbed through the ranks. It has taken me 8 years to become a nursing officer. Maybe I'm even in my 9th year, and I'm a nursing officer. Then I want to go and pursue physiotherapy, degree in physiotherapy. Yes, your current grade is a diploma. You still have a diploma, and you want to do a degree, and you are thinking, because a degree is higher than a diploma, I should earn more. But already your nursing officer within the service, although you have a diploma, is what? A degree grade. And for that matter, its equivalent salary grade is 18L. So Ubeko school now by 3 years, 2 years, whatever years that your course of study demands, you will come back and you realize that you are at a disadvantage because what? You are still going back to your 18L. So it's almost like you went in a circle. Same for physician assistant, same for radiographer, same for a public health officer. So please let us be guided in this regard. Requirements for membership program at the Ghana College of Nurses and Midwives. Nurses and midwives intending to pursue any of the membership programs are required to have the requisite qualifications and should not be on a grade below what nursing officer. Many a times you may be a senior staff nurse, senior staff midwife, and you know for you to qualify for a membership with the school, you ought to have a degree. So maybe you rush to CAF or any of these schools, and then you were able to secure a degree in your pocket, which is good. It has added up to your knowledge and to your personal esteem and all that. But within the service, we are saying that if you are not a nursing officer on grade, not that if you don't have a degree, or if you are not a nursing officer, don't apply for a membership. Now, some of us don't really get the difference. There is the associate membership, which usually takes a period of 1 year. And then there's the membership, which sometimes may take 2 or 3 years, depending on the qualification you have to apply. So we are not saying the associate membership. We are saying membership, which will now make you the nurse specialist. If you go for the associate membership, you become a nursing officer. You don't become a nurse specialist. This is the little difference that most of us are not aware. The associate membership is 1 year. And usually when you're on a diploma grade and you do that, we upgrade or convert you to a nursing officer. Then we put into brackets, pediatric, into brackets, neonate, into brackets, perioperative. We put those things into brackets. But then when you go for the membership, which is you must have been on a degree grade of the nursing officer and above, you come back and we'll call you nurse specialist into brackets, pediatric, nurse specialist into brackets, neonatal. So that is the difference. So if you have not secured a degree or you are not a nursing officer, then possibly you would now have to apply for the associate membership and not the membership. Because Okoha apply for the membership, you will not be granted what? Approval. The screening process will catch up with you. And then you find out that your document has been what? Exempted or taken out of the ones that will be recommended to headquarters. So please, let us take note of this. Now, those who were already on the grade of nursing or midwifery officer before obtaining the requisite first degree are required to serve for a minimum of 3 years from the date of obtaining the certificates to become eligible for what? Consideration. We all know that you may enter the service with a diploma as a staff nurse. Then you serve 8 years. You become a nursing officer, but you may not have a degree. Yet you are a nursing officer. So now, if you are a nursing officer, when you became a nursing officer, you didn't become a nursing officer either through conversion or upgrading. You became a nursing officer by what? Promotion, which is 8 years in the service. Then what you ought to do is make sure that whenever you obtained your degree was 3 years ago. So it means that if you obtained your degree in 2023 and you want to go for a membership, you will not be what? Considered. If you obtained your BSc degree in 2022, you will not be considered for what? A membership program, although you have your degree. But this is when you got your degree after you were promoted to a nursing officer. That is why even to date, it is expected that those who obtain a degree after the nursing officer grade still serve 5 years before they become SNOs or SMOs. Because you already got into the grade before what? Getting the money. Sorry, before getting the requisite qualifications. So you're already an NO and you have a degree. It means nothing else what can be done for you. So please, I will be sharing the slides after the presentation with chairman so that you can be going through to guide you. Now, staff on certificate and diploma grades applying for master's program. It is same here. Staff who have certificates, some of us have diploma, we've done our pocket degree. And then because we are very ambitious, we would want to pursue an MSc or an MPhil in nursing or whatever program of our choice. But what they are saying here is, or what the policy is saying is, staff who are on certificate or diploma grades but are desirous of pursuing masters or postgraduate programs following the acquisition of a bachelor's degree, you are first to apply for what? Upgrading or conversion. With that, your degree you have, so that you can now serve the required minimum number of years before they can consider you for your masters. So you may have your master's, you may have your degree with you, what we normally call a pocket degree, but you are still a diploma person, you are still a certificate person with the system, you are still an enrolled nurse, you are still a community health nurse, you are still a staff, senior staff midwife or senior staff nurse. If you apply for a master's, it means that they are not going to grant you the approval. So first, what do? Write a letter, inform the service that I have what? And a bachelor's degree, so and so, and I would want you to do what? Consider me for upgrading or conversion. It is after they've done that, you've served some number of years before you can be considered for a master's program. To draw down the curtains, these are, I've also shared this with Chairman already. These are steps that will guide you in assessing and then declaring your intention on the portal. So you would first have to go to your browser and then you type in this text, or you can I think the link already is on your various platforms. So when you click on it, it's going to take you straight into your browser. I have observed a number of times that people want to use the Google app, not the browser. Make sure you are using a browser. If it's Google Chrome, if it's your Internet Explorer or whatever. I don't mean use a laptop, but there's a difference between that Google app that most of us like using and the Google Chrome browser. They are not different. They are not the same. So make sure you are using the browser. I say this because there are some challenges or difficulties you will encounter when you use the Google app and not the browser. This web page works well when you are using the browser. So please use the browser so that you'll be able to see the screen as you should see. And then all the things that you are supposed to take note of, you'll be able to. Because there are some buttons or panels that will not show when you are not using the browser. First thing, when you hop on it, you would have to click the register button. You are going to see a login interface. Because you've not registered, you don't have any login details. So first, you have to register. When you click on register, your staff ID, there's going to be an interface where you'd have to put in your staff ID or your employee number. So you put in your employee number. Another page will pop up. And as I mentioned earlier, it's going to tell you your name, your date of birth will be there, your current grade will be there, your current facility will be there. Then it's going to request you to enter a valid email address and password. Now, this is the thing. Most of us are thinking because they are demanding email, they are going to send us a message in our emails, of which when we forget our passwords, we can go there and do correct password. That is not how our system works. So I normally tell people that be conscious of the email you are typing. There have been several cases where, per se, you are going to type in kwameboating@gmail.com. Because you are in a rush, you type in Kwame, then you omit your, so it becomes a Kwame OA, then the thing continues @gmail.com. That is what you use to register your account. Now, because in your head, you were thinking Kwame Boateng, you may think that is your valid login details. So you will now hop onto the system to log in and then declare your intention. And they tell you that your email address is not in the system or cannot be accessed. So please make sure you are typing your email address that you intend to use and same for your password. I would advise that you get a notepad, or today we are in a digital world, your phones have notepads and all that on it. Save it somewhere so that all the time you can go and then do what? Access it. Don't do we like to do very often, save logins. Don't do that. There are a couple of times people do the save login and they've made a mistake. When now you go and then key the actual email on your system, it won't allow you. But then you use another device and then it sails through. So please don't go and do the save password. Write it somewhere. Then there is also a place where you can lodge a complaint, or you see your HR if your information is what? Inaccurate. So when you see that your information is inaccurate, don't go ahead and put in your email and password to register your account. screenshot the information you are seeing that is inaccurate, and then go and see your HR. I will say your HR first because that is faster. The complaint hub will take a while before the designated officers will respond. And maybe how they will see and respond, their literature may not be sound or an understanding enough for you. But then when you go to your HR, they will be able to fix the issue fast for you. Once every information you have on there is accurate, then you click to submit. So this is when you are now what? You have successfully registered to declare your intention. That is phase 1. When you are done with that, it is going to take you back to the home page where you'll be requested to log in with the email and password you just created. So you log in and then it will take you to the interface to declare your intention. You are supposed to fill all the required fields, including the program you intend to pursue. And we are saying that you can use the course dictionary, which you will find on the portal, to view programs you can pursue per your grade. So this is a way to guide you to know the kind of courses the service is recommending for each and every individual. So click on the course dictionary and every kind of course that you can pursue per your grade will show there. So that you don't go ahead and choose a course that has not been recommended for your grade. Automatically, you disqualify yourself. Although you will submit, although you will sign and then give it to your HR, thinking that you are part of the race, you have been disqualified even before what? The gun is shot. So please pay attention to this. Now, when you have duly filled your form online, you click on the submit button. Another page is pop up, and they are going to ask you to review and print your declaration of intention form. At this stage, if you realize there is issue, they are only asking you to review. It means that you can do what? You can make correction. Some of us, we are always doing things in haste. But what you need to realize is speed is as much as important as your direction. If you are doing the wrong things fast, you're only putting yourself what? In harm. So please make sure you are doing the right things slowly. That is effectiveness. So review it as the computer will be telling you. Review the thing. Don't say that I'm so confident that I keyed in the right things the first time, so I won't review, I will submit. Then usually after submitting and printing, some are patient enough to go through. Some won't even bother to go through. Then they just bring it for the HR. So please make sure you review your application. Make sure it is exactly what you wanted to say. Before you submit, you finally print, you sign and submit your HR so that your HR can do what? The further processing. I will end my presentation here. I think Chairman can take over.
Thank you.
We tackle them.
Questions and
Mr. Combian.
Yes, sir. Yes, sir. Thank you so much. I mean, you've opened our eyes to a lot that we did not think of, which I believe is some of the reasons why some of us have not been getting study leave after applying for so many times. And also for some of us who are yet to apply, will now know how to apply, the courses we are supposed to choose, how it will affect or impact our salary, and even some of the short routes. Like if I do 1 year associate program, I'll be converted to a degree person. That is if I have diploma. But if I'm going to pursue that same program for 3 years and they all come out with the same salary level, that's an eye opener. So we are so grateful for your time. I think we'll open the forum for questions and answers. So we'll have to try to do it, one after the other. So probably you can also try to write your questions in the chat sections. Yeah, so I've seen you just raise up your hand. If you don't know how to raise up your hand, we will see how best we can sort it out. You can also try to give us an indication on our WhatsApp platform. So Honorable Secretary, Honorable Leo will be taking note of that. If you don't know how to raise your hand on Zoom, you can just let us know, on our WhatsApp group that you have a question. So we'll mute you for you to ask your question. All right, so first question, I'm seeing Maxwell, your hand is up. Please go ahead.
Thank you, Honorable Chair. Thanks to our moderator as well. I want to ask, during the presentation, he made mention of an applicant being rejected if the applicant has a disciplinary proceeding or pending proceedings against the applicant. I would want to know who is responsible to handle that. If an applicant has a pending disciplinary proceeding, who handles it at the facility or BMC level or at the district level? And then if it's ticked or if there's a portion on the printed document that has been ticked, do the applicant have the access to check what has been ticked, or once it's ticked by the HR, by the director, or by the head of facility, go straight to the region? And then for fear of victimization, I want to know when such documents are submitted to the district with regard to the disciplinary proceedings, for fear of victimization, do they do any background check or engage whoever the applicant is to confirm whether such things are true? Because I fear if there are no checks, for fear of victimization, someone might apply, leave the printed document with the HR or whoever should handle, and then the person will be checked that the person has, meanwhile, probably it's not true. It's just to pin the person or just to prevent the person from getting the expected leave. Thank you.
Thank you, Maxwell. I think that Maxwell has a little bit of trust issues. But Max, I'm giving you an assurance as one HR person, and I speak for and on behalf of all HR practitioners in Central Region. I don't know of other HR practitioners in other regions, but then we have been advised, and to some extent, I wouldn't say advised, I would say warned, and even instructed professionally that if we are to say, and it is not the HR who will say, that part of the endorsement is done by your district director. So if district director is to take or inform or is to say on your application that this person is currently facing a disciplinary action or proceedings, and it's because the person did X and Y, they say book no lie. It means that the person will now have to get what? A document and attach to substantiate their claim of you being what? Facing some disciplinary proceedings. So it's not just like they can take or they can state, and that is all. Now, one thing is also that after the results are in, the provisional list are in, and then you think like the system has not been fair or the service has not been fair with you, as an employee, you can apply and state that maybe as a grievance report, and write, I am Maxwell so of this where who I've served for these years, and I declared my intention to pursue BSc this or program X or Y in the month of this. However, when the provisional list came, I realized that my name is not in it.
Well, I think we are missing the line.
unexpected and not selected. So if it is proceeding, then they are also, this is what, and it was one of the grounds for which we did what? We disqualified your application. Sometimes you may be qualified, no disciplinary action, no nothing. But it's just that if we say we are looking for the longest serving person, maybe it's a slot for 15 people. And you may be in Ekumfi and you served 8 years, thinking that, oh, when it comes to Ekumfi, amongst all the applicants, Dora is 6 years, Kwame is 4 years, Ajwa is 5 years, this person is 8 years. So in that kingdom of the blind, you are the one-eyed man, and you are perceiving that because you have 9 years to your credit, when I study even. But remember, you are not competing against the staff in Ekumfi. You have all the staff from Winneba to Swedro to Abradunkwa to all those places, even to Asen Central. So there will be somebody there who have served 11 years. And because that person is 11 and you are 9, you may be the longest serving person in the Ekumfi. But the 11th person in Asen Central gets it, and then you don't. I hope I have answered back all right.
All right, Mr. Maxwell, I hope your question has been answered well.
Yes, Honorable Chair, but where I have a bit of doubt is sometimes the person can write the grievance report to region. The damage would have been caused already because we've moved around Ekumfi a bit, and then wherever we went to, there were complaints about study leave, of which you ask them, then they are not able to pinpoint that this is the problem or that is the problem. So when he made mention of, because I was trying to look at how do people apply and then they are not rejected, they are rejected. The quota system can count the number of years and all those things. But I was trying to still pinpoint what can also be another problem. So if it can be a way, like for instance, Nauka Polyclinic, we have a head of BMC here. If we have a head of nursing here, if there can be a way that in case such documents come and then disciplinary proceedings are, because we cannot fill document and then paper no lie all right and attach it to document and submit. But if there can be a background check before the approval, rather than approve and then the grievance report will come in. I don't know whether after the grievance report, it shows that there was a different proceeding pending and then it happens, it wasn't so. Maybe they can fix it for you because I feel the damage would have been caused already. Thank you, Honorable Chair.
All right, Maxwell, I think maybe my submission was too long that you didn't pick the information I was trying to convey. I am saying that if whoever states that you there is a disciplinary action pending against you, even when it gets to wherever it should get to, that is how come I'm saying we were advised, we were instructed, and I used a lot of huge words showing the gravity of the onus that lies on us as HRs to ensure that the system is fair. So maybe your worry is that what if it's even the HR victimizing you? What I'm saying is when they push that document, you know, we don't disqualify and keep it at the district level. Oh, my dear brother, if you look at the proceedings, I didn't make mention of any committee sitting on your document at the district level. And this document is something that you already have because as of last week, it was already circulating so that all of us will be waiting to hop onto the system today. So when you send your hard copy and they are even saying that this is pending against you, the committee, which is set up at the regional level, will now inquire. Don't forget the regional director is the boss of your district director. And the regional HR or the deputy director HR is the boss of your HR. And they are the ones who form part of the committee. So they will call these two persons and ask them, can you give us an evidence of this? And you see, the same system you use in applying, they have your number. They can call you. What I'm saying is trust the process. It is fair. Don't go in thinking you will fall a victim to somebody who doesn't like you, and they will do that under the disguise of there's disciplinary action pending against you. Nobody can say there's disciplinary action pending against you when there are no documents to prove it. Or Max, have you ever come across such an instance? I'm saying the grievance report is when you are writing, thinking, when you are in your own corner thinking that, I think there is a reason why I was not selected, so let me write. Then you write. And then whatever reason why you were not picked, if it's because your years of service didn't meet, like you are thinking you have served 9 years, so you qualify, and they know that the least among the people they selected was 11, they will tell you that looking at the people we selected, this is it, and you didn't meet it. They are going to explain why. And when you send a grievance report through your district, remember I said you are writing it. I think maybe one of these days we'll have to look at the grievance process in the service. Because if you write to a particular office and after a while you are not getting response, you write to another office that is of higher authority. And I would also advise that you inform your chairman. I think I have not known him for that long, but he's quite proactive and he has your best interest at heart. So you speak to him on those kind of issues and then we will see the way forward. Marshall.
Thank you. I'm clear now. Thank you, moderator.
Okay. So, just a quick one, please. Let's all note that if a disciplinary procedure is activated against any member of JRNMA, please make sure you inform your sub-district coordinators or any of the district executives, because we are supposed to be in the known. We are supposed to be part of the board that to go through, that process, so that we can come on board and see how best we can resolve it. So let's take note of that. So I'm seeing Samsung SM. You said, please, what courses can RCN and midwife apply? If you can unmute yourself and ask it. I don't know if I'm asking your question well. Please, what courses can registered community nurses and midwives apply for? I hope I asked it well.
I think I saw same in the chat box, so we can go by that question. I don't know when Song joined our conversation, but I kept on speaking about the fact that all the courses that has been recommended for you per your current grade is already tailored on the system. So me being a human resource manager, I will never get on the system. And when I am selecting, there's a course dictionary. Like I said, click on the course dictionary first. Even when you know the course you want to select, still click on it. So you click and all the courses there are available for you. That is how it is. So I cannot come in and then say I'm selecting public health nursing, because being an HR, even if I want to convert, I'm already on a degree grade and probably I may be earning more than a public health nurse. So, I will suffer what we call diminution. It means that my salary is going to go down and it's going to affect me. And that is not possible. So in a nutshell, just go on the portal. Many of us, the first time you go on the portal, it is because we want to declare intention, click submit and go away. No, this is a very important exercise. So you can go there and view it today after our conversation. Go through it. And if you need guidance on should I select X or should I select Y, then you seek for that clarity. But to answer your question, every recommended program is already on the system for you. And they will just be there.
Okay. Samsung, I hope we've answered your question. Okay, so we have our Techno Come on 16. Please, the floor is yours.
Okay, good evening. I'm Fatia. I want to ask about the associate profession. Can you
Okay.
use your professional grade to apply for it? As in,
Can you use
maybe you've been promoted to a staff, no, like an NO, MO. Can you use that
midwifery officer.
grade to apply for the associate
Okay. But
profession?
do you have a degree?
No, the person does not have a degree, but she has been promoted to that level of the NO or MO.
No, you see, for Ghana College of Nurses and Midwives to admit you for their program, and I'm not speaking for them, I'm speaking based on experience of applicants over the years. The school also has its own criteria for selecting people. And they will prefer that you have a degree in order to pursue a membership. So the reason why Ghana Health Service is stating it emphatically is that they don't want the situation whereby they give you a provisional approval, then you don't even have a degree. So you apply for the program at Ghana College and you are not granted. Meanwhile, it may be too late now for them to do it. Give it to another person. So please, you may be an MO or an NO. You can go back and check the information. You cannot just apply when you got onto the grade, the promotion. You must have a degree. And per what they are saying, if you have a degree. Hello, I'm listening. Techno.
Okay.
Hello, Techno. You were saying something, madam.
Yes, I was saying that. So even though you have gotten to that level of grade, but you still need to do the degree before you can apply for that.
I'm going to answer that question with an advice. Whichever institute, yes, with an advice. Whichever institute that you want to pursue your program, and this is not just for Madam Techno, it's for everybody. Do the due diligence, contact the school and ask them that this is my qualification. I don't mean this is your grade in the service. They don't run the programs for Ghana Health Service. They provide tuition for whoever they want to pick. So it is not just about a Ghana Health Service affair. It is the institutions too affair. So I want to pursue this program. However, I have a diploma. Can you admit me into the program? Then they'll tell you, no, we can't. Because you would have to have qualification this and maybe should have even worked for a period of this in order to qualify to pursue this program with us. Please, am I making some sense?
Yeah, thank you.
Yes, so it's not just about this is my grade in the service and I'm applying. No, you may have your grade in the service, but whichever program you want to pursue, try and communicate with your desired choice of school and then take clarifications from them or the advice that they will give you. Even know the duration of the program, because there are times that people have gone ahead to, based on the advice. Let me share this experience with you. Somebody was thinking one particular school was still rendering tuition for public health nursing on sandwich basis, but they did not do the due diligence to ask the school. So they just applied on the system, sandwich, public health. Then, unfortunate for the person, she was granted the approval. But now she goes to the school and the school says that we no longer run sandwich for public health nursing because we don't get the people to run the program. So now anybody who wants to pursue public health nursing would have to be a regular student. So now because such a person did not do the due diligence by asking the school, She has obtained provisional approval for Sandwich Public Health Nursing, but the school is no longer doing that, and she can't go to school. And steady leave now. So please, it's not a first come, first serve. Let's not rush this process. Do all the due diligence. If it's going to take you even the 9th of October, take this month to do the diligence. Make all the enquiries you need before you hop to the portal. Thank you.
Okay, thank you.
Okay. So just to add up this, I am an example of what our facilitator has mentioned. I applied for maternity leave on the closing date, the last day. But luckily, I was granted to leave. So as he said, it's not based on first come, first serve basis. So let's take our time to do the due diligence, make the inquiries, make all the calls to get much information. So we have, okay, so please say if a person has served for 3 years but has not been promoted to senior enrolled nurse due to sickness, can the person still apply?
When the
That is
person
how-
says, all right, thank you. When the person says due to sickness, may I ask that, is the person on a sick leave, an approved sick leave? We have to
Okay,
get this question before we can give an answer.
Okay. So iPhone, if you can unmute yourself and then make the clarification for us. iPhone, please, are you there? iPhone.
Okay, let
iPhone.
me answer that on a yes or no basis so that we save ourselves some time. I think we've been on call for quite long. So if it is a yes that you obtained sick leave, then it means that even now as we speak, you are not well. So for somebody who is not well to work, or we will say fit to work, my brothers and sisters, do you think such a person is fit to school? The answer will obviously be no. And if such a person has not been granted sick leave, then it means that maybe due to on humanitarian grounds or human face from the director or their BMC head or their supervisor, they are just helping the person through. So they've not informed officials about whatever he or she is going through. Then I will advise that in the same vein, don't even worry yourself to apply unless you believe that God will heal you before the due date to go to school. Other than that, you will apply, the time will come and you will still be unfit for school. If I have made given some answer to that, let me go back to Maxwell's worry and then just bring some clarity. You realize that every year after the provisional approval list comes, we'll be there maybe a month or 2 or 3 or 4. Then another list will come. Usually it will just contain 12 people, 13 people. It doesn't contain a whole lot of people. Possibly, those are the people who decided that, let me follow up with why I didn't get it. Possibly, those are the people who said, I have served for 15 years and I chose this program. However, I didn't get it. Can you explain? Because to err is human. Humans can commit oversight. Even computers have some margin of error. So if they check and realize, we didn't do due diligence with this gentleman's work, they will equally forward say to director, due consideration will be given. And then you realize that another list will come. Then it's just 7 people. Then your name is included. Thank you.
All right. Thank you so much. Honorable Leo, so our secretary, please, the floor is yours.
Thank you very much, Chair and Mr. Minister, for the insight. I would also want to request, on popular request, some of us would want to know the full list of courses that
All right. Secretary, thank you.
Okay, we have our senior on board. Miss Georgina, please, the floor is yours.
Okay, thank you very much. Please, can you hear me?
Yes, Gina, you are allowed.
Okay. Yeah, thank you very much, moderator. I think it's been a laudable work you've done so far, and I've enjoyed. I've gotten much knowledge and then into it, and it will help me and guide me. I don't know of others because I really looked up to this for a long time. And then thank you to our executives for this, and it's much really appreciated. We think more of this will really help us to guide us to choose the best. I wanted to talk a little about the Ghana College thing. Most of the times when it comes to that, we get a little bit confused, and some of us didn't get much about it. We didn't get much information about it, but the little that I could tell from the little that I've gone through, because I've been privy by God's grace to do the membership, associate membership. That's it. So with it, it's the Ghana College is not academical. Like in a sense that somebody will ask what is not academical about it. If you are going to do a degree, for example, and you have an associate membership, you cannot use that to maybe get into the school, but you can use it to maybe boost up your CV if you want to maybe get a job or an employment. Why am I saying that? If you go in to do an associate membership, which normally is 1 year, you have to go back to school and then do a degree before you can do the membership. That's what makes it a professional thing. And then it runs down to even the doctors. So the doctors have their college, which it is basically for their professional level. So it makes you a specialist. But you cannot use that certificate to maybe further education or something like that. So with the little that we were told with it, most of us had to choose the other way and be like, okay, for instance, if I have to get my CV done and upgraded for a job market, then which means that I need it. If it is just for school, then maybe I might want to overlook it. And then on the top of it, on our ranking of our pay today, our moderator made us understand, because most of the times they make us know that, oh, when you go to Ghana College, when you come, oh, your money will go a little bit high. But here is the case that it all gets the same rank, even after you go to the Ghana College and you come. So no matter what, you even broaden down to the NO level, which is the 18L. So I think that is the little experience I had, and that is what to help maybe some of us. So if you want to do the 1 year, which is associate membership, then even if you have a diploma, I think the school, if it's due and they want to admit you, they admit. But if you want to do the membership, which is for 3 years, the school also decides on that and who to take. And that is what our moderator explained to us. So that is the difference between Ghana College and our normal academic trail. Thank you very much.
Thank you, Madam.
All right.
Madam Georgina. Well said.
Okay. Thank you so much, Miss Georgina. And then we have Retadita. They are saying, please spare your advice on the selection. How do we know the quota? Because you advise, the quota for selecting. So please, he mentioned that the quota will be released, and then when it's released, I'm sure we'll get a hand of it and we'll share it for all of you to, see it, so that it will inform you on how to select or apply.
Right, Chair.
Please, do we have any other question? Miss Mavis, if you are here, you can unmute yourself and ask your question. Miss Mavis. Okay. Please, do we have any questions? This is a very good opportunity for us to ask all our questions. Okay. Okay, I think someone just saying to me that she will be due for promotion next year. And so she's asking whether or not she can still apply for the study leave. So to that effect, let me use myself as an example. Last year, when I was applying for study leave, I knew I'll be going for promotion this year. I applied. Now I have been promoted. I've gone for my promotion. My letter is in. My school admission is somewhere in October this year. So I'll still go to school. I still went for my promotion. Yeah, so that is my experience. But Mr. Mensah, if you could add on that.
Yeah, hello.
Yes, we can.
I'm here. Oh, I thought you were trying to bring that to the point.
Okay, so the person was asking, she will be going for promotion next year. So she was asking whether she can apply for the study leave or not.
She's going for promotion. Do you mean the second half or next year?
That will be next year. Next year.
And the person is currently going for a promotion as a nursing officer.
As a senior staff midwife.
As a senior staff midwife. I'm
Yes.
confused though. But what program did
Okay.
was she the provisional approval for?
Okay, so now this person is yet to apply. He hasn't applied yet. So she's asking whether she can apply.
Okay, asking can she apply and then go for the promotion? You see,
Yes.
yes, she, if only the system allows her based on the program she will choose, right? So let's say this person decides to go for a BSc midwifery because she's a midwife. Let's assume that is the case. Currently, you would have to serve 5 years to apply for a BSc midwifery. But judging by the fact that this person is yet due for promotion next year, it means the person has only served 2. So such a person, when she gets on the portal, clicks
Hello, I think we've missed you. Okay, I think there is a network issue at his end. However, please, if you have any question and you don't know how to raise your hands, you can type your questions in our WhatsApp group right away. We have less than 10 minutes to leave. We've spent quite a number of time here.
Hello.
Yes, sir. Please go ahead.
Yeah, sorry, my network got distracted a bit. So it means that the person 2 years will not be able to apply because the required years of service is 5. So this person will get a prompt on the system saying that you've not served what the minimum years required. But I also believe that if this person wants to pursue a program, which is no, she's a staff nurse, staff midwife. So it means that she will just need 2 years. So it means that such a person, the system may permit. When I say may permit, it depends. For somebody who is now for 4th year, so next year will be 5th year, the system will permit. But somebody who is 2 years, next year will be 3 years, the system will not permit. For somebody who is 3 years, the system, like next year will be 4 years, the system will not permit. So it's only 4 years and beyond So even if you are 5 and then you go on and the system doesn't permit you because it has been automated, contact your HR. If I'm 3 and the system doesn't permit me, intentionally still contact your HR. If you are 2 and the system still doesn't permit you, still contact your HR. I have my reasons for saying this. There are times that maybe there is an issue somewhere, and that is why the system is not permitting you. So you go ahead and contact your HR. Then your HR will now come back to you and say, oh, this is the reason and this is the reason why you are not able to do it, to apply for this program. I think that will be the best advice I'll be able to do it, to give you. Because sometimes, like I said, the system has its own challenges. Per the way maybe they configured your information in the system, it may not allow you. And it could be as a result of an error. So go back and speak to your HR, and then your HR will seek more information and then get back to you in due time. Thank you.
All right, thank you so much. So as I said, we have just 10 minutes to leave. We have Barbara. Miss Barbara is saying that, can someone apply for more than 2 courses at the same time? Next question is, I want to know the number of years served in the service from November 2020 to September 2024. So I think she wants to know if somebody started working somewhere in November 2020 up to September 2024, that will be how many years on the system?
That will be 4 years. I think that one is quite obvious. It's 4. But like I'm saying, such a person should still get on the portal and apply. Until the portal tells you otherwise, please and please, my people, go on there and apply. Even if your friend says, "Me call you and my mind," yeah, don't assume that will be your case too. Please, from experience, go on to the portal. Until the portal tells you you are not eligible, don't listen to anybody, including myself. Thank you. I think there was a first question before this.
Yes. She was, can someone apply for more than 2 courses at the same time?
No, please. The portal allows only 1 course per time. That means that the person themselves, they don't know whether they are going left or they are going right. But I believe the service is saying that per, our level, we are supposed to know what is ahead of us before we jump. So you can't be torn between X or Y and then you still go. Confusion is not good. So please help somebody who will now direct you, settle on one program. If you don't have a career plan, get somebody. If you have a mentor or somebody you normally go to for professional advice, seek that advice and then select one program that you really want to pursue. In the chat box, I'm seeing somebody asking, what kind of special, let me check it again if I find. Please, can a certificate nurse pursue a specialized course in degree? The answer is no. Because normally when you want to pursue BSc Ophthalmic, BSc Perioperative, they would require that at least you are a registered general nurse. They require that at least you have a diploma so that you do the top-up degree. So please, it is not possible unless the schools decide that they are going to change their criteria for what accepting or admitting people to run their programs. But as it stands today, say I'm going to do BSc emergency nursing, please, it's not possible. Thank you.
Okay. Please, is there any other question? Okay, so yeah, okay, that has been answered in the group. So how long will you advise a person to work before applying to enhance their chances of getting? Okay, Honorable Leo, the floor is yours.
Okay, so please, thank you very much. So I would also want to ask, apart from the direct nursing and midwifery courses, does all these rules apply to the other allied health courses like the disease control, the HIs and the nutrition? Because we didn't hear much of them. All we had was BSc nursing and stuff. So how about that one? Do they also follow, or there are some special regularities about them too? Thank you.
Okay, thank you, Secretary. I think I certainly made mention of something concerning this. You know, when we got to the conversion, where I took the time and pain to explain the difference between upgrading and conversion, and even drew your attention to programs that you meet. I am tired of nursing, I want to pursue. Meanwhile, because of where you've climbed your current grade to, it will be to your own disadvantage in terms of the salary you earn. So you would want to pursue the entire technology, public officer, nutrition, public officer, health information, all those ones. You would still have to now check and see on what grade am I on now, as in your salary grade. And the one I want to hop onto, what is the current salary grade? So that you don't suffer the diminution I spoke of. It's like you yourself, you are causing your own harm, knowing that what you are doing will not profit you, but you still want to. But there are times where you will still, because you have the passion, you still want to, and you don't mind losing some salary for it. Actually, in practice, this is what happens. There are times these things happen, but sometimes if they really consider you for the grade, it means that when you are done, they'll find a way out for you. That is the best I can tell you. But since it has already been established in the guidelines, and they are asking that the regional team, which is a committee that will be approving our applications, should take note. I won't advise that unless you know your passion for your job exceeds the money you earn. You know, there are some people who really want to do their job regardless of how much they earn. Then I'll advise you to jump. But if you are the ordinary Ghanaian who is always looking out for salary before they do their work, then I'll advise don't do it. Because it means that even if they try to help you out, you may be on one particular salary grade for some years before when your new promotional grade exceeds your current one. You will be moved onto it. So let me explain it this way. Assuming you are the superintendent committee illness, like I was saying, and 16H, and then you go to pursue a diploma grade that will start you from 15H. It means you are behind. Maybe best case scenario, and I'm not speaking for the future, I'm speaking for the past, because things can change even when we end the score. But as it stands now, when you are being granted provisional approval, the best thing we can do for you is, if you are in my facility, I will still speak to you when you submit. When I speak to you and you still want me to forward, we will still forward it. When it comes back and then you are granted everything, what we are going to let you understand is, when you come back, because you are now going to earn 15H, which is lesser than 16H, we will do the upgrading, we will do the conversion. Now you'll be called a public health desk, you'll be called a dental technician, you'll be called a physician assistant. As for your new name, we will give it to you. But then we will not touch your salary. Don't expect a change or increase in salary. We are still going to let you take your old salary grade until you go for a kind of promotion where the grade supersedes your current. So until you go for promotion and you are going to earn something beyond your 16H, your payslip will still reach superintendent community health nurse or superintendent enrolled nurse. And this is where most of the times people regret that decision they took. Then their love for the passion of the job dies, and then it comes to money. And they come and say, HR, me buy, ma convert me kama. And so my age, 2 years in me. The salary that na me ko school na me na no na me je. You can't share on a winty. So please, if you really want to convert, go and see your HR. Your HR has all the salary grades and they know how much everybody earns. So they will tell you if it's your advantage, they will tell you that this course that you want to apply. When you come back, these are the issues. If you still want to go ahead, you go. If not, then you don't. Thank you.
Okay. So we are taking our last question. So someone is asking that Please, what grade can you have to leave the nursing field to catering? If you want to leave the nursing field to catering, what grade can you have? Okay.
You
Miss
see,
Frida, eh?
all right. For tell me, you're laughing there. No, when it comes to career progression, like I said, there are so many things, factors that will prompt one to either go for A or for B. So for somebody in my madam's situation, we have what we call hospitality manager. That is somebody who has a degree. And we have what we call a catering officer. It is somebody who has an HND. So if this person will be kind enough to tell me where they fall, if the person is say an enrollment or certificate holder, and you are going for an HND, I said it again. So what level be say you're a principal and you are earning, I think 15 something, or maybe 14 HR. I stand to be corrected, but I know a catering officer, as I presented in my slides, which you can now go back and check, will not start from 15. Again, will start somewhere from 14. So it's almost like you went to school to study for a whole 3 years, just to come back and take the same salary again. It's just that your job have changed, yes, but nothing was attached to your salary. So it comes down to what I was answering for Mr. Secretary again. Please, let us be mindful and let us draw close to our HRs and ask them. However, if you can't, channel those things to your chairperson. I'm sure you forward them to me, and if I have any advice on that, I would reply same, and then he would reach out to you and give you the feedback. So there are so many things that are involved. It's not just about the salary. Sometimes, you may have a genuine reason why you want to be going to catering. So when you're in your HR sets, and those are some of the things that HRs do. Unfortunately, I've been in the service for long, but you don't usually come to us for those things. You come and say, HR, Madam Funiko promotion, what you for praso. When the letter falls before HR, everything is, you don't come to us for this kind of services because it is your HR who can really guide you, tell you more about whatever professions that are within and without the service, whatever opportunities that you can enjoy. It's not always just about the salary. We are limiting our discussion to the salary because that is what is in the guideline. But even there are some places that when you have certain grades, you can't work. There is no way they would want me or even request me to work in a health center. It can't be possible because per our staffing norms, you should never find a human resource manager at a health center. The least place you can be is either a hospital or a district health directorate. You will never find an accountant at a CHIPS compound. That is the staff ceiling. That is the technical name for it. It's called a staff ceiling. So these are all some of the things that your HR will be taking you through to let you know that this program that you are going to offer. Possibly you won't be working with us here anymore. It means that they will be taking you here. So don't think that because I'm going to do catering, then even if we don't run catering services in the Ekumfi, director will find me some cooking pot and things so that I'll be cooking for them at the directorate. It's not going to be possible. The service will look for where your services will be needed, and then they place you there. I hope I have exhausted the question.
Sure. Sorry, someone just sent another important question. That please, do you have to write access course before you can apply for a degree program as a certificate nurse? And also the other question, the person said she was a certificate holder with senior community health nurse grade, but I think that one is based on the salary level. So just look at the salary level. I think it's captured in the presentation, so you can check that. So do you have to write access course before you can apply a degree program as a certificate nurse?
Okay, I think the person joined us late. If not, let me reiterate what I said concerning that. it is the school where you want to pursue your degree. They are requesting that, right? An access program. Yes, we are going to ask you on the page when we realize that you are, I think it's not even just about being a certificate holder. Even on the page, when you choose your program, usually they may ask that, is it an access? Do you have an access course, or do you have put in your access index number? So it is the school that is running the program, be it CAF, be it UHAS, be it whatever. Because you are a certificate holder trying to leap into the degree, they want to test you. That is how come you go for the access class, then they give you some exam to write. And then based on your performance there, they admit you for the program. So it is not really a Ghana Health Service thing. It is a school thing. So if you happen to find yourself in some school somewhere that says that we can admit you with your current certificate without an access program, it is the school that is doing it. But the issue here is, please find out if they are accredited. If you happen to gain admission in a school that doesn't have the right accreditation to run the program, but the Ghana Health Service will not accept their admission, and you'll be asked to either change your school or come back to post. Thank you.
Well, all right. Thank you so much. We'll let our former vice chair close with a question. Our former vice chair, Miss Dorcas, I think you said please kindly touch on this for me, if you can clarify on that for us.
Hello, Chairman. Hello.
Yes, please. The phrase, we can hear you.
Hello, Chairman. Okay, good afternoon. Please, the moderator was talking about the, if you are a health promoter, if you are a community health nurse and you want to go into health promotion, it's like he was something after the hello.
Yeah. Hello, we can hear you.
Hello.
Your line was breaking. I want to believe you're
Okay,
asking
so
about
hello.
yes, we can hear you. So I think you want to ask about the issue of, let's say, an enrollment at a senior principal level or at a superintendent level and wants to go and do health promotion. Meanwhile, at the end of the day, the salary level will come down, will come and start from, somewhere 40 or 50. And so he mentioned that we have to take advice on that because most often in Ghana, we all go to school because we want to have an impact in our salary or the amount of money that we are taking at the end of each month. And so for you to go to school, spend a lot of resources and time and pay money, you come back, your salary level is supposed to, come down or reduce. I think it's not worth it. But as he mentioned, if by virtue of you have a passionate reason or a specific reason why you still want to do that, fair enough. I think you also mentioned that there are instances where they do consider. So even though you've gone to do the course, you are back, but they won't touch your salary level or your salary grade. They'll just allow you up until when a promotion that you'll be going for will affect your salary, then they can decide to touch your salary. So I think this is very, 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 very important. I understand that is why you drew our attention to that because most often you just say, I want to go and do nutrition, I want to go and do let's say a technical officer. But no, he said,
Any of the allied
you see. So
yes.
yeah, for this session,
Yes.
I believe anyone who has been part of this is actually blessed, and the resources, the knowledge that we've obtained from this will help us and guide us in our career path. So I want to say that we have our district executives on call. Our vice, Ms. Gloria was here. Our secretary, Mr. Leo was here.
Thank you,
Our
Chairman.
treasurer, you are welcome, please. Our treasurer, Ms. Abigail Suga, was here. Our former vice was also on the call. Our sub-district coordinator for NAQUA, Mr. Maxwell, was on call. Our sub-district coordinator for Ochuan was on call. And our seniors, our senior Miss Georgina was on call. She gave us some advice. She has some experience as far as Ghana Colleges are concerned. So thank you all for availing yourself for this session. I believe we've learned something. And Mr. Mensa, we are so grateful for availing yourself for, using this time. That's almost 3 hours to take us to preparing the slide, answering all these questions. We are blessed to have you, and we are hoping that anytime we need such a session or anything else to do with human resource related, we'll call on you and we'll be glad for you to come and then take us through. So thank you so much for this session.
Right. Thank you to Kombian for having me, and thank you for your time and patience. And as I earlier emphasized, if anybody wants further clarity or some challenges, kindly see your chair. He is very able and proactive. He will find a way of contacting me, and then we'll know what to do. But before I say goodbye to us, or there is somebody asking if the access course has to be before or after your application. It can be before and it can be after. When I say can be before, maybe you wrote your access last year, and according to your school, maybe your access admission can last 2 years. There are schools like that. Some say 3 years. So depending on the rules of your school, if it's 2 years and you've already you did it last year, it means 1 year now and you have 1 year more to go. So it can be used. But as we all know, now in practice, before, you're applying the school for next year against next year, not this year. So it means from now until every school decides that we are not admitting anybody again, or admission forms will not be sold, you can still go ahead and then apply. So I've never written my access yet. I haven't. You can go ahead and apply now and say, I want BSc Nursing, I want BSc Midwifery, I want BSc Public Health, or whatever program. And then, like I said, before that, contact the school. I want to be in your school next year for this program. What is the way forward? They will tell you, oh, we are going to have our access course program starting in January. And this, then oh, we've already done it. And looking at our admissions next year, we are not doing any access course at all. So if they tell you that information is reliable enough or dependent enough for you to know that, no, this school may not do any access course for next year. So it means if I don't have one already, then let me find out from another school, so that you have to know your end, and then it helps you know the routes to take. So it's a yes and it's a yes, either before or after, provided it is still valid with your school, they will grant you the admission. So on that note, thank everybody once again. Mr. Kombian, over to you and your team.
All right, thank you so much. Can one of us pray for us to close? Any of us? Okay, Vice, please go ahead.
Okay, we are praying. Dear Lord, as we come to the end of this meeting, we thank you for the wisdom and guidance you've provided. Help us to take whatever we've discussed and learned today and use it for our betterment. Watch over us as we leave this platform, and may your blessings follow us as we carry out our work. In Jesus' name we pray. Amen.
Amen.
Amen.